On behalf of all of us at New York University School of Global Public Health and our co-hosts at Steinhardt School of Culture, Education, and Human Development, we welcome you tonight to our timely program, When Misinformation Goes Viral, using TikTok to fight COVID-19 disinformation. My name is Julia Cartwright. I serve as Senior Associate Dean of Communications, Promotion, and Public Affairs at GPH. We will be recording this event for those who are unable to join us, and we welcome your questions, so please direct them to the Q&A function. It's now my distinct pleasure to introduce my colleague and tonight's moderator, Dr. Carlos Chirinos, an award-winning Associate Professor of Music and Global Health here at NYU. Dr. Chirinos' current focus is on health communications and promotion, teaching our Foundations of Global Public Health course at GPH, and for the past several years, co-teaching with me our Health Communications and Social Norm Change course. Please join me in a warm welcome to Dr. Carlos Chirinos.
Thank you very much, Julia, and thank you very much to the NYU School of Global Public Health community and to the wider community in New York City, in the United States, and worldwide, hopefully. I'm sure we're having guests coming from all over. It is an amazing opportunity that we had to really have probably three of the most interesting creators, I would say creators, but also scientists and practitioners in public health and health communication, and to be with us today to really explore a very important aspect of dealing with a pandemic. In this case, dealing with misinformation and how misinformation drives a lot of the behavior change that we require in order to get out of this pandemic. Partly the reasons why we explore health communication and the areas that we explore in health communication is precisely what will take to turn human behavior in the right direction. Currently, the burden of disease globally, over 50% of diseases can be attributed to human behavior. And that's an important aspect of understanding the burden of disease globally, especially when we talk about infectious diseases, those communicable diseases like COVID-19, the behavioral component becomes even more dramatic. We also have, obviously, an understanding of how behaviors are impacting chronic diseases like heart disease, cancer, diabetes, and whatnot. But I want to cut to the bottom of this topic by really introducing our esteemed speakers today, Dr. Catherine Wallace, Dr. Eric Burnett, and Dr. Sijia Panwar. And I want to start, I would say, with Dr. Catherine Wallace, also known as Kat, the epidemiologist. and maybe just if you guys introduce yourselves, say a little bit about your background and whatnot. And we start with Kat, and then we go to Eric, and then Sijia.
Thank you so much for having me. My name is Dr. Catherine Wallace. I'm an epidemiologist by training, and I work at the University of Illinois at Chicago School of Public Health as an epidemiologist and an adjunct assistant professor.
Excellent.
And hi, thanks again for having me. I really appreciate it. My name's Dr. Eric Burnett. I'm a board certified internist. I work as a hospitalist at Columbia Presbyterian Medical Center here in New York City, a little uptown from where you guys are at NYU. And I'm an assistant professor in clinical medicine there. So I do a lot of teaching as well.
Hey guys, thanks for having me. This is I'm Sijia. I'm also a board certified internist like my colleague Eric here, and I'm currently finishing up my cardiology fellowship at Tulane University down in New Orleans, and I'll be moving to New York, as I was telling these guys earlier, to join NYU Langone Health to do another fellowship in a few months. But happy to be here, talk to you guys about this very important topic. Thanks for having me again.
Thank you. Great. So, I mean, these guys have been very humble in their introductions. Each of these guys are known by millions of people, literally, on a very well-known platform, social media platform, known as TikTok. I'm sure that if you are making it to this talk or the recording of this talk, you have some or have heard about TikTok, are using actively TikTok, or have heard of somebody that somebody else has told them about TikTok. Currently, as with other social media platforms, perhaps it's important to point that TikTok is perhaps one of the fastest growing platforms at the moment, currently reaching over 1 billion people in terms of users, in terms of people actively using the platform. And that's about 1/7 of the world, which is an amazing feature. Obviously, when we talk about social media in general, the tendency is to talk about social media being a contributor, right, to the spread of misinformation. But on the other hand, based on the work of our colleagues, we can see that there is active engagement in opposing those misinformation kind of trends. And I wanted to start kind of a conversation among ourselves, really, on this subject, and learn a little bit about how you guys do what you do, what inspired you to do this. And perhaps we can start by, breaking down the these two topics that may sometimes be confused or may be put in the same pot, which is misinformation and disinformation. Misinformation being kind of perhaps more genuine confusion, whereas disinformation is that more active delivery of wrong information in order to create misinformation. So I was wondering if you guys, want to, jump in and tell us about your experience with these two subjects, with disinformation, misinformation, and generally about how you use the platform.
I mean, I can just start. I mean, the reason I started on TikTok, I downloaded TikTok for the same reason everybody else did, because I was bored during the lockdown in March of 2020. And I didn't really have any aspirations to be a content creator at that point. I just was scrolling and looking at people dancing and people's cooking videos. And then unfortunately, at the same time, seeing a lot of COVID-19 misinformation. And at that time, it was more like COVID isn't even real, that it was all just a plot to overthrow the election or so doctors can make extra money. And it was like, so for me as an epidemiologist, I just felt like I couldn't sit idly by and watch that happening. So it sort of something inside me just drove me to start making videos. And then there was this thirst for real information out there by at least some of the people out there. So here I am still doing it. But it all started because of misinformation.
Yeah, and to sort of echo that, I downloaded it for the exact same reason, to sort of take my mind off of the horrors of the pandemic that I was seeing in the hospital, just to sort of say, okay, I need a break from all of that. And yeah, I was watching funny pet videos, and then interspersed were people saying, oh, the pandemic is fake, or don't wear a mask, it's not going to help you. And I saw this starting to spread very rapidly, and I said, well, maybe I can give my perspective as a doctor who's actually treating COVID patients, who's seeing the devastating complications, because, maybe people in quarantine are wondering, why am I here? I'm not seeing anyone with COVID. I'm stuck in my living room. This is horrible. To give them a perspective, and it sort of took off. But I realized that this misinformation, probably from people, profiteering off of disinformation, more so now with the vaccine disinformation, but to sort of either push a political agenda because they realize, hey, my constituents don't want to wear masks. This is politically advantageous for me to say masks don't work, to come up with some, half-cocked study that says that masks are useless. But then that spread as misinformation among people on social media, and it was dangerous because then it led people to engage in riskier behaviors, which then made my job as a doctor harder because more people got sick.
Yeah, I'm probably the youngest I'm on TikTok among the three of us, because I started back in March of this year. And for me, it was more so just I needed a break and I needed something else in my life besides my daily work. And I did it just for doctor humor, medical humor, just to watch some funny videos, right? For me, it was, and I distinctly remember I responded to this one misinformed person joking about COVID and how it doesn't exist. And this was a video I had made in, I don't know, February or March, when a couple of weeks after I started. And that took off. And the comments that I got on that video made me realize holy crap, there's a lot of, like, I had no idea because I'd been on TikTok maybe a month at that point. And I had done some social media advocacy about the vaccines, et cetera. But, really my whole exposure was limited to my own circle within the city that I'm in, right? So I had no idea what was going on globally or even across the country. And then that video took off and I'm like, wait, people actually believe this? And then I made another video, and then, it was a domino effect from there. And similar to Kat and Eric, I mean, there's a lot, I was like, there was a need to step in and correct some of that. So I was happy to join the ranks of all of the other great medical creators on there. And, the content creates itself. I don't have to go looking for it. So
that's for sure. The comments are fodder for it.
Exactly.
It's so true. Like today I was scrolling and I saw some lady saying, like, if you need ideas for topics, there's this website, Ask the Public. And I'm like, people really need that? Like, because there's so much misinformation.
I just go through my comment section and there you go.
Yeah, there's no shortage of topics.
Well, it's interesting. I did the same. I joined TikTok mainly because one of my main interests is the music industry and popular culture and how music impacts behaviors that relate to health, to physical health, mental health. And I started following the platform, and something I remember clearly, for some reason, at some time during the pandemic, maybe halfway, there was this trend that probably the most popular TikTokers were nurses. And it just intrigued me. It's like, why? What? And not nurses talking about COVID-19, nurses doing dances in their breaks.
Oh, right. Yep.
Right. So that was my first kind of like, there is something here with health workers and TikTok, something. And obviously kind of that led to my interest obviously in like what else is out there. And I think I started following you guys at least some months ago, some 6 months ago at least. And I started realizing, wait, there is obviously the misinformation, but there is this other side of the story. And as we know, the algorithms in these platforms kind of don't necessarily show you, once you start saying no to misinformation and to weird posts, the platform stops showing them to you, right? So that's on one hand, and then obviously the more you like posts like yourselves, then you get more sort of correct information. But nevertheless, I thought I was very impressed with the work that you guys were doing, and was very curious to understand how the public, what is the reception of the public. And I want to do something before we move on, which is probably some of our audience right now have seen you guys, some of your posts, but I want to make sure that they actually see them. And I want to show one post of each of you. So I'm gonna show them all in sequence. Let's see. Let's hope it works, and then we can talk about it.
Natural immunity is 10 times stronger than synthetic immunity.
Antibodies that result from COVID-19 infections are highly variable between people, both in the strength of response and the duration.
People that are against the vaccine mandates are not anti-vax, we're pro-freedom.
If you want to be in public during a pandemic, you gotta participate in public health.
I'm 33, strong and healthy. I've already had COVID. It did nothing to me, but now I have antibodies and natural immunity that are far, far stronger than that synthetic vaccine.
Compared to people that were fully vaccinated, people that were not vaccinated had 2.3 times greater odds of reinfection. Fully vaccinated breakthrough cases had 49% lower odds of long COVID than unvaccinated COVID cases.
So I am protected more than the vaccine can protect me. Also, the vaccine will not stop me from transmitting the virus.
Vaccinated people are 5 times less likely to get infected in the first place with Delta variant than an unvaccinated person. So you cannot spread a disease that you don't have. So we're already starting out 5 times less likely to spread it.
Why would I go take a vaccine that has killed so many people? Made so many people go paralyzed? Destroyed the cognitive function of so many people? Why would I go put something so dangerous and unknown inside of my body? Somebody please try and tell me something intelligent that would make that make sense.
Do you want to tell us about that video, Kat?
Yeah, that one's just sort of like poured out of me because I have every once in a while I'll see a video that makes me so angry that I just drop, and I know Eric does this too because I can tell by some of his, like, just see a video that just gets you so worked up that you don't even care what else is going on. You're gonna stop and just respond to it immediately. That's how that one was. And I had already recorded several other videos that had kind of talked about different studies responding to some of his points. So I'm like, I'm just going to splice and dice things that I have already recorded with data and just kind of go from there. And a lot of what he said was nonsense and doesn't have any basis in reality. So it was just one of those ones that just was nonsense from beginning to end and very easy to dispute everything he was saying.
I like this video also because you really use not all the features, but you use a lot of the features that are classic TikTok, right? You use music, different types of music. You use really kind of trademark sounds like the oh no. Have you had any kind of training doing kind of this type of work?
You know, it's funny when I look, and you guys can chime in on this too. When I look at my early videos, they're so bad because I didn't know how to use TikTok, and all I was trying to do was like talk about the data. And as time went on, just trial and error and using the platform. Like I never had any professional coaching or anything on it. I just have kind of over time learned how to do things, and I'm still not very good, honestly. Like that video is probably the pièce de résistance of my skills of editing, but honestly, like I still am learning stuff all the time.
Yeah,
and I'll add to that. Sorry, Eric, go ahead. I'll go after you.
I was just going to say, like, the more you use TikTok and the more videos you see that are popular and go viral, those are that you sort of adapt your videos and your style to that, like using certain trends and things to make it. Because I sort of try to do a mix. Like I try to do like the funny ones, because I find like the funny ones are where I'm snarky. That tends to do better than if I'm just dry and talking about data. But then again, I try to be as professional as possible. Earlier on, I was probably a little bit snarkier than I should have been because I was just so frustrated. And I saw those videos went crazy, but then anti-vaxxers and COVID deniers were like, oh, you're just rude, you're dismissive, you're petty. So I was like, well, let me try to, be a little bit nicer in my videos. But still, I try to mix it in, be a little bit funny as well to make it less than like I'm lecturing you and more trying to, make it
I was just going to say, TikTok I've tried all of the social media platforms, and TikTok was perfect for me because you need zero editing skills, right?
Yeah.
So if you look at my videos, I'm walking in most of them, right? Or I'm just splicing together. I'll record 20 seconds at a time and I'll splice it again. with another 20 seconds, zero editing. I mean, the TikTok platform is actually very powerful. You can do so much with it. Green screen video, green screen, pictures and text and trends and this and that. I mean, I use maybe about 20% of it, and I've now become consistent in what I use. So and the fact that I don't have to, put filters on or do fancy editing means that I can record a video in about 10 to 20 minutes or so and put it out there. And just to Eric's point, I love being snarky, but I try to do it in a way that people can tell, So, but it is what it is. But yeah, that was a great video, Kat. I love it.
Thanks.
Well, actually, on that point, Siab, let's play one of your videos so the public can see what you're talking about.
While that loads, I'm going to talk about that. So all you need, I think, to gain traction is a message that you want to talk about and a passion to talk about it with. And that's it, right? And just find something that pisses you off.
The widespread vaccination has led to the widespread emergence of variants.
So all these do your own research people don't actually do any research at all. For the 50,000th time, the vaccines do not cause variants, okay? The Delta variant existed before the vaccines came out. You can Google this. And for anybody that needs this basic biology lesson again, variants occur when a virus mutates, and that can happen when a virus is allowed to replicate unchecked in a population. The vaccines significantly reduce the ability of the virus to replicate, therefore significantly reducing the chance of a variant occurring. The Delta variant is highly transmissible and can spread much faster in unvaccinated people than it can in vaccinated people. And I know what the CDC said, what it said back then about the vaccines and transmission. But they said that in light of the data available at that time. A lot more research since then has shown that the vaccines absolutely reduce transmission of the Delta variant. That whole video is bullshit.
Oh man, the second video I made in response to this, I think I'm a lot more passionate. But, so what I like to do is when I feel like my stuff is getting a little dry, because as Eric said, when you talk about data that can be dry, I find people tag all of us in all of these crazy videos of people just talking about unbelievable stuff, and that's like content makes itself, right? So you stitch them, and TikTok has this amazing ability where you can stitch videos, as in you can take part of somebody else's video like I did and make a response to it, or duet it so they appear side by side. And at any time we find videos that are, some of them turn that feature off, which is unfortunate, in which case we just screenshot it and then make a response.
Yeah. Anyway.
Yeah, but sometimes we find that opportunity, and it's just something I saw that video, and if you watch the whole video, it's just a whole pile of BS essentially, and I had to respond to it, and that was the result.
Yeah, I mean, and I think a good element that I think comes across is comedy or humor, right? I mean, we're talking about very serious subjects. But the use of humor maybe helps. Do you think it does?
Oh, absolutely.
Yeah,
I mean,
sure.
absolutely. I think, there's a fine line, and everybody has their own way of doing things, right? So when I apologize for that. So when I respond to misinformation, from somebody, what I tend to do is, I'll try to make it humorous and highlight how what that person is saying is absolutely wrong, and then sort of call them out on their inability to do research or inability to critically think, or just highlight the fact that they are obviously spreading disinformation, right? Mm-hmm. And the humor sort of comes out, right? Everybody has their own way of doing it. I try not to attack like the individual person, because that's not the point of this. The point is to attack the message and not the person.
Correct.
And I think I don't know. It's just my way of doing it, and it works for me.
Yeah, I think there should be a fine line between antagonizing people and kind of making more invitational, I guess.
And so many of the points of misinformation like this, that video was a perfect example, is that so many of these misinformation, things that go viral are just so demonstrably false. Like variants are caused by vaccines. Like if you look at where any variants have popped up, it's been areas of high transmission and low vaccination. So it's like we all kind of have the data on our side all the time, and we have studies in our link tree proving everything that we're saying. So it's kind of like, I don't know why they keep doing it.
Because I think, sorry, Eric, go ahead.
It's just the misinformation is just so common. Like anti-vaxxers think they're very like clever and original, but I'm convinced it's like the same like 15 talking points that are just recycled. So whenever I hear something or they tag me in a video, I'm like, I've got this information already saved. I've got all the graphics, I've got all the talking points. So it takes me 10 minutes to make a video because I'm like, I've addressed this 15 times already. And it's just, again, they think they've figured it out. They figured out something that all the world scientists and doctors somehow missed. And then they're going to tell me, they're going to come into my comment section and be like, well, aha, you're wrong.
I got you.
Again, I try not to come off as condescending or rude, but sometimes when what they're saying is so out of left field and crazy, me addressing it like shedding a vaccine, like you get a vaccine and all of a sudden you're sneezing out spike protein everywhere. That sounds very dumb. So me trying to like explain how that's wrong comes off as maybe me, lecturing them or being very paternal, but it's just the nature of trying to dispel that misinformation.
Yeah.
Right.
To be honest with you, I don't think I've heard an original conspiracy theory in the last couple of months. It's all the same recycled garbage. It's all the same garbage from the last 6 months. Bill Gates and depopulation and the vaccine. And it's causing infertility and all of that. I think the latest piece of this is actually, I don't understand, the idea that the FDA has not fully approved Pfizer's vaccine because the name is different. It's approved Comirnaty and not the vaccine under EUA when it is clear that the two are the same thing. And I've made several videos explaining this, but there are still people intentionally, and I understand that there are people that have valid confusion about this because the FDA's documentation is not exactly very clear to read. But there are still people coming on my videos saying, well, the FDA didn't approve that vaccine. What are you talking about? And conspiracies are just way more attractive than a scientific paper, to be honest with you.
No, that's true. And the way that Carlos started to mention this about how the platforms are designed. So if you're interacting with certain content, you'll keep seeing that same kind of content, right? So that's why in a situation, in an environment like that, misinformation tends to go super, super viral because it gets shared a lot, it gets watched a lot, people are intrigued by it. Like, oh, this is a secret the government doesn't want me to know, and so that's going to go crazy viral over me reading a scientific paper, right? So in that regard, social media is part of the problem.
Yeah, that is essentially the reason why we try to explore this in more detail, because I think for most practitioners that are not necessarily in public health communication, most people assume that social media is the enemy, and in fact, it is partly right to say that, but then on the other hand, we have people like yourselves and maybe more, and there are definitely many more that are doing their part to try to counteract that misinformation. Great. Let's watch a video then now by Eric, and then we can talk about it.
Is there a study that shows that? Yes, it's fine. Boys more at risk from Pfizer jab side effect than COVID study suggested. U.S. researchers say teenagers more likely to get vaccine-related myocarditis than end up in the hospital.
So I've been getting tagged in that video a lot, so I'll begrudgingly talk about it because it's about Joe Rogan, so I'm sure I'll get hate for it. But that was his interview with Sanjay Gupta, and he had this aha got you moment where he said, hey, teenage boys are much more likely to get myocarditis from the COVID-19 vaccine than they are to be hospitalized with COVID-19, and I've got proof, and he showed this article. It was this one from The Guardian. Now, he didn't show the actual study, just this summary of it, but for reference, this is the actual study he was referring to. You can read it yourself. It's a preprint study, so again, not peer-reviewed. Now, One of my major critiques of Joe Rogan is he is not a scientist. He does not understand how to read and critique scientific literature. I mean, every time he brings up a scientific paper and starts blabbering on about it, it's very obvious he doesn't really know how to critique it. Because I read this study and it's full of flaws. I'm not sure it's even going to make it through peer review. So first of all, the authors of that study just basically did a dumpster dive into VAERS and tried to find cases of myocarditis in teenage boys. And they just had access to the public VAERS that everyone else has access to. They didn't have access to the patient's charts or medical records. They used a positive troponin as a inclusion criteria for myocarditis, but in teenage boys, a lot of things can cause an elevated troponin level, like going for a jog can cause a positive troponin level. They actually included people who had other infections like COVID-19 in that myocarditis group, so there were a lot of confounders that they didn't control for. Some of the teenagers in that group had an unconfirmed COVID-19 vaccination status. And this study was done pre-Delta, before there was a surge of pediatric COVID-19 hospitalizations. The risk of COVID-19 infection was much lower when the study was done than it is currently. But because Joe Rogan is just very one-sided, he didn't even bring up this peer-reviewed paper from the New England Journal of Medicine that looked at the absolute excess risk of various adverse events following COVID-19 infection and COVID-19 vaccination. And while there is an increased risk of myocarditis and pericarditis following COVID-19 vaccination, that risk is much higher following COVID-19 infection. More kids are getting infected with COVID-19, so there is a higher risk of getting a COVID-19 complication like myopericarditis, which is higher than that of the vaccine. And that data in the paper that Joe Rogan presented, which was full of methodological flaws that he neglected to tell any of you about, was at odds with the data the ACIP collected when they were doing their risk-benefit analysis for these vaccines in teens and adolescents. And you can see, while there is a risk of myocarditis, that risk doesn't outweigh the benefits of vaccination in terms of the reduction of COVID cases, hospitalizations, and ICU admissions. I don't know, maybe Joe Rogan should just stop talking about shit he doesn't understand. Just a thought.
I'm always reluctant to do a video on Joe Rogan because he has such a fervent fan base that I think that's why the videos go viral, because I get so many hate comments on it that it really pushes it onto the For You page for a lot of people. But that wasn't the first time I've done a video on Joe Rogan, because he just like Googles random things and then he brought up a paper talking about leaky vaccines and imperfect vaccines from a vaccine in chickens, for a herpes virus in chickens. And if you actually read the study, it was basically saying that like the chickens who got vaccinated, the ones that survived. And you can't take a study about chickens and attribute it to the human vaccines, because it's just like comparing apples to cinder blocks. But people were tagging me in that and be like, see, Joe Rogan says you're wrong. And I didn't know, I thought Joe Rogan was Fear Factor. That's the only reason I knew him, until I looked into this and I saw, and he's like, oh, he sort of plays himself as this like middle of the road, playing devil's advocate, but he really does push a lot of anti-vaccine rhetoric, a lot of it. And that video, oh, go ahead.
Sorry, I was just gonna say, I don't even know what a leaky vaccine is. I still don't know what a leaky vaccine means. Like, what does that even mean, right? And as I said, I'm someone who I practice cardiology, so I see myocarditis. Like, that is literally part of my bread and butter. So I see this every single day. And to see people talk about it that don't know what they're talking about, like Joe Rogan, for example, and 99.99, well, actually 100% of anti-vaxxers that talk about myocarditis, they don't know what they're talking about, right?
That's
the way
right.
they describe it, the way they talk about what it looks like, the way they talk about prognosis, and the fact that they don't talk about, that it occurs on a spectrum of severity, and it can be all the way from mild, which is what happens with the vaccine, which is rare, all the way to severe, which is what happens with COVID infection, and the fact that it can leave you with lifelong debilitating heart failure, or it can kill you, right? Or you need a heart transplant. And the fact that I've seen young healthy people with COVID infection myocarditis, like essentially dying or severely ill, like without all of that nuance that you don't have unless you're actually taking care of these patients or actually are in the practice of taking care of patients with myocarditis, even before COVID was the thing, you can't talk about it, I think, in an intelligent way, right? At least the way that the anti-vaxxers, it's just not a thing. And it's just unfortunate that one of my most popular videos are of me responding to this kid, I'm sure you guys know that video I'm talking about, that had myocarditis from the Pfizer vaccine. And I made a 3-minute video talking about, why it happens and what are the risk factors, et cetera. Unfortunately, that person has sort of turned to more anti-vax now, but the misinformation gets 10 to 20 times as much attention as the correct information does. So
especially when it's spread by someone like Joe Rogan, who has such a huge platform and such a very, very dedicated fan base. And they're like, well, when I say, he shouldn't be interpreting these studies, they say, oh, well, you're just being an elitist. People can't read studies. I'm like, you could read it. Doesn't mean you understand it. And if you read that study, it's really bad because they just basically use the vaccine adverse event reporting system, which is a passive reporting system. Anyone can report to it. And I encourage people to go onto VAERS and just look at some of the reports and tell me that death of a pet is related to the vaccine, that someone who got into a car accident driving from their vaccine appointment is a vaccine death. It's just really, really silly. Like someone got gonorrhea. I think they were trying to be a little sly and blaming it on the vaccine, and they put it in there as a vaccine adverse event. Someone put dark circles. I wish I could blame my dark circles on the vaccine. It's responding to these TikToks that are aging me.
I think at some point you have to defer to expertise, right? That's the reality of the world we live in. Like, I'm not gonna come up and tell Kat that I'm a better epidemiologist than she is. Like, I'm not an epidemiologist. So when she talks about epidemiology, I listen to what she's saying. And when Eric talks about internal medicine stuff that I haven't seen in a few years, I trust what he's saying. So you defer to people that know more than you. But that doesn't happen on social media. Everybody's an expert.
Everyone is an expert.
Everyone is an expert. That is part of the problem, actually, all right? That everybody has the same feels they have the same level of feels their opinion is as valid as knowledge, and that is one of the biggest challenges, right? That we are, or the current environment has made opinion, and the political discourse definitely has made opinion and knowledge kind of equal. Well, you have your opinion and I have mine. Well, no, this is no opinion, this is knowledge. So,
and at the beginning of the pandemic, there was a lot of chaos and a lot of there was a very low, at least I find on social media, and I was actually a little surprised because I teach graduate school science classes, that there was a pretty low level of science literacy in the general public. And so that, coupled with some very loud voices that were not scientific voices joining in the discourse, plus the social media algorithm situation amplifying that information, sort of set us up for this perfect storm of misinformation that we've been sort of fighting against ever since.
Yeah. And I think talking about this, and we're gonna get to the some of the questions from our audience pretty soon, but kind of doubling down on the issue of disinformation, kind of I think you suggest that, Eric, that kind of Joe Rogan's video is really intentional. And I think there has been kind of a lot of disinformation around the ivermectin therapies and the famous meta-analysis that suggested that essentially ivermectin is an effective treatment against COVID. How do you guys have you guys come across that specifically, and how have you dealt with it?
Yeah, I think that's probably one of the biggest pieces of disinformation, because it really picked up steam as the anti-vax movement picked up steam, because it's an alternative to the vaccine. And it sort of plays into this, oh, we're hiding a cheap and effective medication so we could push a vaccine and make money. When in reality, it's just not true, because it's an antiparasitic. It's a great antiparasitic. And I think for the part of the media where they could have done a little bit of a better job is they just sort of only branded it as like a horse dewormer. And granted, people were taking the horse dewormer version of it. They were going to the feed store and taking it. So I could see where that, came about. But then people were like, oh, you're hiding it. It's a Nobel Prize winning medication. It's used in humans all the time. And I don't doubt that the scientists who discovered it did win a Nobel Prize. I prescribe it when I have a patient population from the Caribbean. They come with, strongyloidiasis and parasitic infections. I use it, but it's just not used in COVID. And unfortunately, it's become very political, and like meta-analyses that come out that are, again, meta-analyses are only as good as the studies that go into them. And the studies that go into them are trash. I don't mean to they're poorly designed, full of bias, retrospective, small sample sizes. Some of them are just flat out fraudulent. They get-
Fraudulent, yeah.
So, but then that doesn't matter to them because they don't critically analyze these papers. They see the headline, they read the end of the abstract that comes up with this is the mortality benefit of ivermectin. And that's all they need. And then they hear certain doctors who may or may not have financial gain by pushing ivermectin, and that's all they need. That argument from authority. They find that one fringe doctor who's like ivermectin is the miracle drug of miracle drugs, and that's it. And then it goes and anything I say to the counter is I'm a big pharma shill trying to push a vaccine that's killing 2 people for every 1 person it saves. Like, it's just nuts.
And these doctors that are a lot of times the natural or functional medicine or chiropractors that are saying to use this are also selling a whole regimen with supplements and other things that they are personally benefiting from. So it personally benefits them if people don't get vaccinated, get symptomatic COVID, and then have to use their solutions or whatever.
I think the biggest thing, as Eric said, is that several of these studies, the largest studies, are fraudulent, like straight up made up data. Dates like June 31st, right? That don't, or something like that, or patients that have died before they could be enrolled in the trials. I mean, it's just made up data that goes into these meta-analyses. As Eric said, one of the biggest things I hear from anti-vaxxers is, oh, a meta-analysis is the highest level of research, right? But if you're putting in garbage studies into a meta-analysis, you get a garbage result, right? But again, it doesn't matter because I think the cognitive dissonance is so strong.
It's confirmation bias too. They literally will Google ivermectin good for COVID and find these studies, and that's all they need.
No, Eric, they don't use Google. They use DuckDuckGo.
Right. Google's too too mainstream. It's too influential.
There's a lot of censorship going on Google, but and then they find that fringe doctor that is being oppressed and censored by mainstream media, and there are a few. The unfortunate reality is that there are actual physicians that support this, and they're the ones that give this any of the, a lot of the popularity I think comes from that, is from a group of few doctors saying, oh, this works. Right.
The fringe group. In a way, I think this helps explain this information, right? I think this information, the active making up of data and information, has a purpose, and maybe following the money helps you understand why. So there are some people interested in definitely boosting the price and the value of certain medicines, and on the other hand, for political reasons, right? Not to boost the sales of a medicine, but to boost the credibility in their own political agenda. And unfortunately, this is not just the case for the United States. As I was telling you before, I've seen the ivermectin case is being officially sort of prescribed in some countries around the world, including Venezuela, my own hometown, which is concerning. Concerning, to say the least. I want us to move on just briefly on this topic. Of disinformation and that you have received so much hate mail. How do you deal with that, and how do you deal, particularly those of you who are active health workers who are seeing patients every day? How you deal with burnout and how it affects yourselves?
Yeah, I think I just turned off my direct messages. I had to, because I was just being flooded with really angry messages, and it was just getting very dispiriting just to read all of them. So I made a video telling people, listen, I'm turning them off. If you have any legitimate questions or concerns, feel free to leave a comment. So that's usually how I get people who say hey, I got the vaccine because of you. They leave a comment, but I had to turn them off because I also was doxxed back in February, where some crazy person put my information out there and said that I'm killing people, and I'm pushing a vaccine that's killing people, and they were trying to contact my job. So it's this is too much. I didn't go into this to have this happen to me. But burnout is very real. Compassion fatigue is very real. But I try to remember the reasons why I'm doing it, because I did have a patient a few months ago who sort of heard that vitamin D was great for COVID. So all they did was just take mega doses of vitamin D and kept taking it. Didn't help them not get COVID, but it did help them get, malignant hypercalcemia, where their calcium level was like well above the limit of detection, and they were going into kidney failure because of it. And they said, listen, I just heard from people, because it's a vitamin, it's natural, it's better than vaccines. So I said, this misinformation is literally landing people in the hospital. It's literally killing people. So this is why I do it. Even though I have to sort of sustain these like, nasty messages that, I've gotten a lot better of just sort of letting them off my back. Earlier on, I was taking each one as like a personal insult, but I said, you know what, I have to realize that some of these commenters are not well, and I have to just, ignore what they say.
Mm-hmm.
Yeah, that's exactly true. Like, you just have to dissociate from it. And I think we all kind of have PTSD by this point with it, because it just kind of has to roll off. Because I've also had a doxing incident, myself and 2 other creators. And we had to get a cease and desist against an individual for doing this. And it's scary when it happens, because you don't think of, when I started this out, I was very naive and I didn't really think. It's a very weird feeling knowing somebody wants to cause you harm, but you have to kind of think of it as like all the other side of the coin. Like, there's so much more positive than there is the negative. There's a lot of negative, but for every negative person, there's like 10 people saying that they watched our videos and they got vaccinated, or they showed our videos to their coworker who got vaccinated. And that's the reason that I keep doing it, because there's so much more of that than there is of the bad stuff.
Yeah, I mean, in my case, I'm kind of sort of used to some of it. Obviously, the social media hate, sort of TikTok is a whole different level, but I'm an immigrant person of color, physician in the U.S. So sort of what I went through, I've already dealt with some of this, so I've sort of found ways to cope. And honestly, I'll be honest with you guys, like I find those comments very entertaining, and they give me life. They give me motivation to keep going. They give me content. It's free content. I don't have to think about it. Like, that's how it, all I have to do is click reply with video, and then I just unload all of my day's frustrations in a 60-second video. I mean, come on. So that's great. I have gotten some personal threats to my like safety and whatever, but thankfully none of that has materialized. So I try to anonymize myself in my videos. Like, I don't reveal where I work. I mean, you can look each of us up. We're public figures, but I've had instances where I'm just burnt out a little bit. I'm like, F this, I need to take a break. So then I'll like slow down. And I think that's part of taking care of your mental health.
Right.
And at this point, I used to do this thing where you can see where you've been mentioned, or like you can search for yourself. And I used to do that a lot. And then I stopped doing that very quickly. Very quickly, I stopped doing that. And I block people that, that leave me like dangerous messages. I don't block otherwise. And I just go through the comments, and at this point, I'm just like, sure, heard that 20,000 times already. Like, come with something new, right? It's all the same old. And the fact that all of us get messages, I got vaccinated because of you, or I got my dad vaccinated because of you, or I got my friend or family member vaccinated because of you. The fact that we're actually helping make a change, even if it's a small change. And I think collectively as a community, we probably helped thousands of people get vaccinated. And I think that's amazing that do that, and all you have to do is just take out your frustrations in a 60-second video. And I think that if that's all it takes, I mean, it's worth it to me. So.
Yeah, there's a payoff. There's a payoff, right?
And I get to meet all of these amazing people, right?
That's huge.
We have created a good community, so that's definitely a benefit.
That's good. That's good. Well, in the end, I mean, do you guys get, hate mail, but you have confirmation of some behavior change, which is in the end, the ultimate goal of all of these exercise that you are doing, basically, right? Promote, and not only promote, but actually move the needle from awareness to behavior change, which is so challenging. Is so challenging in health communication and health promotion.
And that gets to the issue of anti-vax versus vaccine hesitant, right? So we're not talking to that group of people that's sending us hate mail. Those people are not who we're talking to. We're talking to the people in the middle that hear the misinformation, get scared, but aren't really sure what to listen to. So that's who we target for behavior change, to your point. Like the other group, we aren't going to reach them. So we don't even try, right? And if they try to message us, we just kind of ignore them.
Because I get so many messages of people saying, I don't know what to believe. How do you know what to believe when there's so much out there? So it's putting it into context. When I try to tell people, like, well, just gotta take a step back from all of this and look at the people who are saying this anti-vax stuff. And if you're in an echo chamber, it's going to seem like that's all there is just all this anti-vax stuff. And of course, you're going to ping it off one another, and you're just going to sort of, this is all there is. You don't get an outside perspective. So I tell people, try to approach us with an open mind. And like to Kat's point, the true diehard, pure blood anti-vaxxers who don't want to, they will not listen to reason. They've already made up their mind. They are so stuck in their ways that it's a futile effort. It's like just to sort of get through to them. But those people who are just scared and saying, well, you told me my kid's going to get an inflamed heart, their heart's going to explode. Joe Rogan said this, I don't want my kid to have a heart attack, but then it's just basically putting it into perspective, giving them the actual data, free of that anti-vax passion, that taint to it, that really is devoid of logic and reason and data, and is just all driven by just this misinformation and this fervor and this hate.
Exactly. And that's why building trust is so important with that group of people, because the more we can provide evidence and show it in our link tree, show that we're real people with our sense of humor, and the fact that we are academic people that work at universities, like I feel like building trust with that group of vaccine hesitant people really helps, because the anti-vax crazy videos, those aren't showing data to support them. It's just, some guy talking at a school board meeting or some conspiracy theory. So it does help to try to build trust with those people.
Absolutely. Guys, we don't have a lot of time left, and I'm aware of your busy schedules, but I would like to go over some of the questions from the audience.
Sure.
We received a number of questions, and I'm gonna read a few. Maybe if we can be succinct in the response, just to see how many questions we can go over. We received quite a few. I'm going to focus on the ones that really pertain to communication and our topic today. And I have the first one is from Molly Magarick. What lessons can lay or government communications people learn from your success in sharing COVID-19 information?
I mean, for the public health, I'm speaking next week at APHA about how public health departments can use, because I'm a public health person, can use social media more effectively. And I'm on a panel about that, so I know it's on their radar. But the public health system in the US is very old school. So we'll see how much we can push them into the 21st century.
And I think a lot of it has to do with just like starting off with people when they're young in school, to sort of revamp, this is obviously much harder, revamp the education about surrounding public health, surrounding science, surrounding statistics. And I think, because again, this is a pandemic, it's dynamic, there's nothing static about it. Things change, policies have to change based on evolving data, but changing a policy on like masks after vaccination, which obviously had to happen with the surge of Delta, that's good public health policy, and that should be lauded, not viewed as waffling or flip-flopping or we don't know what we're talking about, because the scientific method evolves as we learn more. So I think starting off with that, and I try to tell people that, but again, if you're in that mindset, it just seems like you don't know what you're talking about.
I think, all of those are great points, but the one thing that I realized, I think that was most important for me, was that the messaging, is critical, right? And the messaging from the top, from the CDC, the FDA, the government, they will release messages, right? Which are obviously, we understand that, but the way that it is perceived at the grassroots level where we work, like people like Eric and Kat and I, that is perceived completely differently. So perfect case in point is when the CDC withdrew its emergency use authorization for its COVID PCR test, right? that is still being spun. This happened months ago. That is still being spun to say that the PCR test was never accurate and could never detect COVID to begin with, right? It is still being said. Well, that is not true at all. But I think, you have to be very, very clear in how you message and anticipate how it's going to be, how it might be spun into an anti-vax viewpoint, which I don't think always happens from the top, and it falls on us, because that's all we do, right? Half of my job on TikTok is clarifying what the government is talking about, or what the CDC and FDA is talking
Basically, yeah, translation, right? Translation.
Whenever we hear something, we're like, oh, great, now they're going to say this, like.
Exactly.
Right. I have another question from Zihan Xu. How can we ensure that the correct information stands out for the general public among all the various opinions on TikTok?
I think consistency, just especially if, I think because it's the data, it's there, it's the truth, it's the facts. We will pick up on that, and it'll be very consistent messaging. It won't be sort of, frayed and fractured amongst all of us, and we're giving like different snippets, as opposed to misinformation that just goes into 18 different directions real quick, where someone will say something and then it'll get morphed into something else, and then it just turns into another conspiracy. Whereas if you could just be consistent with your messaging, and again, try to approach it again succinctly as well, because people's attention spans are very short nowadays, which is why the 60-second videos are really good. You could just say, this is what they're saying, this is what is actually happening, take it for what it's worth.
Great. Sorry.
No, I said I agree. That's all.
Yeah. And we have a couple minutes left. Maybe we can take 2 minutes extra if that's okay with everybody. But I understand that we all have commitments, including our audience. Lastly, I have Sarah Alexander question. How does COVID misinformation compare to the broader problem of science and medicine misinformation? For example, compared to measles outbreaks among the vaccine hesitants, for example.
So I think that just the fact that, so it's the same, but it's on a much greater scale, right? So we've got everybody right now is at risk for COVID-19 because we have so much COVID transmission going on. So the misinformation is affecting more people because more people are at risk, right? If there's certain communities that are anti-vax and they are more susceptible to measles outbreaks, but that's not the whole country. So this is a specific situation that, like Eric said, it's very dynamic and it kind of ebbs and flows, but it's always kind of high, the transmission. So it's the same principle, but it's on a much grander scale, I guess.
Yeah, and I think there's also a wider health misinformation that's sort of propagated by the, if you might call them, alternative health sources. That, this supplement or natural oil or whatever. And I'm just like, first of all, if someone's having a heart attack, lavender oil is not going to kill them. I'm sorry, And the idea that, oh, why don't you guys talk about diet and exercise and getting sunlight? Why isn't that part of the conversation? And we're like, that's basically what I do in my clinic every single day, trying to take people off of medication and trying to tell them, please, fix your diet. But the reality is that a lot of these things, first of all, it's very hard to do for a lot of people. You can't lose 50 pounds of weight in a week, right? You don't become healthy overnight. And the idea that it's just, a lot of what happens in medicine has nothing to do with your diet and lifestyle. A lot of these things are inherited, and a lot of these things are based on your socioeconomic status and your what you're born into, essentially, which is not recognized by alternative, or people that are of the opinion that we don't talk about diet and exercise enough. And I agree that we have to do a little better at it, absolutely, but that's not the whole conversation.
I mean, we could have a whole episode about that, because a lot of the people saying that are extremely ableist as well.
Yeah, that's the one thing that I learned from this pandemic is just the ageism and ableism that is just very pervasive in our society, because I can't tell you how many people I've said, once I sort of explain my points in the data, they're like, oh, well, it doesn't matter because COVID is just going to affect the old and the elderly and the chronically ill, as if that
That's
means
fine.
as
Yeah.
as if your grandmother's life is just not worth it anymore. And then just to ignore the fact that kids and young healthy people are still getting this, still suffering the consequences. But just because it disproportionately affects someone who's older and maybe has a chronic illness doesn't mean that we've now lost a life that was, could have been living another 13, 14 years, but because of COVID are now dead.
That whole phrase of they were going to die anyway last year, it was just like, what? I mean, it just blew my mind that people walk around thinking this way.
And then when you point that out, you get gaslit by people saying that who accuse you of trying to shame them into getting the vaccine, when you're just like, no, it's the reality that your grandma could get it from you and she could die. I mean, there's no shaming there. It's a reality, and it happens all the time, right?
Yeah. Well, which tells us a lot about, and I think it's funny that you mentioned the whole idea of taking the sun and eating well. It's like a lifestyle change is not going to save you from COVID.
No,
it's going to save you in the long run, but
but
the immediate
right now, you're not
now,
you're not going to lose 50 pounds and gain enough vitamin D from the sun that's going to protect you from COVID.
And and like what Sia was saying, it's like there's chronic disease and then there's infectious disease, and the sun is not going to protect you from COVID. That it's totally different risk factors.
Yeah, totally. Well, guys, this is as much time as we have. I think I've learned a lot from you, and I'm sure our audience has learned a lot from you. I suggest everybody watching this to really go and follow these 3 influencers, medical influencers or health
Please don't call me
influencers.
that.
I know. That's why I did like this. It's been a pleasure to speak to you. I really appreciate the time that you have shared with us and share your knowledge, your experiences, and your guidance. So I have nothing else to say but thank you. Thank the audience. I wonder if Julia wants to say a few words before we close.
Only just to thank our panelists and you, Carlos. Thank you so much for taking the time out of your busy schedules. This was a really enlightening talk. Thank you.
Thank you for having us.
Thank you so much.
And if there is anything we can do for you guys, please do not hesitate, especially Siap, if you're coming to New York, make sure you touch base with us.
Absolutely. Thank you so much.
All right,
Thank
thanks,
you
everybody.
very much.